Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Drea Brit. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hello, welcome back to the podcast. We are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Abbey McLaughlin, who is a registered nurse and international board-certified lactation consultant. She also joined us with her sidekick, 5-week-old Henry, so if you're someone who melts at the periodic sounds of newborn grunts and squeaks, you're in for a treat. You may hear him in the background just a little bit, and he is so sweet. Abbey is the owner of Mal's Milky Way in Appleton, Wisconsin, and she aims to empower families by providing personalized lactation care and education, allowing them to achieve their feeding goals. Like many members of the Motherhood Alliance, Abbey discovered her calling and established her business after experiencing a challenge for herself, and in her case, it was a traumatic first breastfeeding experience with her first daughter, Mallory. Abbey is a wealth of knowledge regarding all topics related to feeding tiny humans, including breastfeeding, bottle refusal, premature and medically complicated infants, latching and positioning, prenatal education, and so much more. In this 4-part series, we take deep dives into multiple topics, including what does a lactation consultant do and not do in episode 1, liquid gold, the benefits and surprising additional uses of breast milk in episode 2, feeding newborns, what to expect and tips for success in episode 3, and finally, weaning from breast and bottle, when to wean and practical tips for success. Abbey offers multiple programs and packages, as well as a free prenatal consultation for anyone who wants to ask questions and connect with her before baby is born. But I do want to mention a special promo she is offering Motherhood Alliance listeners. You can get $50 off of her life cycle package, which, side note, I would have loved to have this when my kids were little, and I would highly recommend it. But you can get the $50 off her life cycle package by using the code MMW3, all capitals, for the MMW. So MMW3 to take advantage of that special offer. Let's dive into today's conversation with Abbey and baby Henry.
Hey, everybody. Welcome to the podcast. Drea and Britt here. We have Abbey in the studio, aka Brittany's dining room today. We're super excited to welcome her and her little guy, Henry. So Abbey, we always like to ask before we get started about kind of like some fun fact about you before people really get to start knowing what you do and all that stuff. So do you have a fun fact about you and your history, anything like that?
Yeah, one thing that I love to share is that I was a competitive gymnast until I was 16, and now my daughter Mallory is following in suit, so it's pretty fun to watch.
That's awesome. Do you still have like the flexibility, and do you remember things? Or
I do, and before I had babies, I could still do quite a lot, and now you guys all know about postpartum bodies and jumping on trampolines. So going back to the gym nowadays isn't always as fun, but Mallory keeps asking me to show her all of my old gymnastics moves. So one day we'll go to open gym together.
We'll keep talking about that.
Maybe we should
help with that.
We should find a video of Abbey. She can send us one. We'll include it in the show notes.
Yeah,
just
there
so
you
we
go.
can see her in that fun prime days of competitiveness.
Yeah,
cool.
That's awesome. All right, so Abbey is a lactation consultant. We're going to talk all about breast milk. We're going to talk about breastfeeding. We're going to talk about bottles. We're going to talk about all sorts of things with this series. So I guess let's just start off with your journey, Abbey. Like, why did you what's your history? Why did you choose to be a lactation consultant? What's your passion with that?
So the name really says it all, Mal's Milky Way. So my first daughter is Mallory, and she really inspired this business. So I am a registered nurse by trade and had Mallory in the height of COVID. So there was no prenatal classes of any kind, lactation, birth, anything. And I thought with my background, I knew just enough that I'd be okay. And boy, was I incorrect. So I actually got in a car accident with her at 28 weeks pregnant that just kind of kickstarted our traumatic pregnancy, labor and delivery journey, which unfortunately many times goes hand in hand with a traumatic breastfeeding journey. After she was born, she was almost a year old, and I had transitioned into my role as a NICU nurse and really thought that I could start supporting moms in lactation in the NICU, and just really felt like the hospital was not my place. So I went private practice so I could support moms in the way that I wanted to.
That's awesome.
What kind of struggles did you deal with when you were nursing Mallory?
So with Mallory, the golden rule for weight gain is to get back to birth weight by 2 weeks. And a lot of people hear that. And she wasn't back to her birth weight until almost a month old. So we really struggled with weight gain. It was horribly painful for me. And I just remember sitting there sobbing through all of my nursing sessions with her. But with, in hindsight is always 2020. One thing that I could have controlled in our journey was breastfeeding. And I was going to breastfeed her come hell or high water. So I really just basically sucked it up until it didn't hurt anymore when she was 4 or 5 months old. And then we just continued on. And I really don't want moms to have to suffer that long and think that just know that there's a better way.
Mm-hmm. I can relate. I was very much the same way with my first child. The first 3 weeks of him after he was born, it was so painful. And I cried between every single feeding. And I didn't really know about lactation consultants outside of the ones in the hospital that you see for while you're there. And so it was a really big struggle. And I'm just so thankful that people like you are now available so that moms don't have to go through what we went through, hopefully, right?
Yeah.
That's the goal.
And was Mallory born 40 weeks or was she born early?
We were induced at 39. So I had a placental abruption. So with the medical aspect, we were induced at 39, which turned into an unplanned C-section. So she was technically full term, but a little early, probably not quite ready. And it just kind of kickstarted everything for us.
Yeah, and I totally get that too. My son was 37 weeks. We had to use a nipple shield, and I just felt like a failure. So when I got hooked up with a lactation consultant, that made all the difference. So hopefully people hear these episodes and they feel really encouraged because this is going to be great. Yeah.
So to start off, there's different types of lactation specialist, lactation consultant. There's different types. So can you walk us through what are the different types and what are they each specialized in?
Sure. So there's ranging from even just a peer support specialist, which is just like a mom friend that runs a support group, which I have, and her name is Emily, and she's wonderful. And there's a lot of peer support like Lactation League, WIC, they have peer supports. And that's really just not a ton of background education. It's really just using your personal experience to help other moms, which is great and helpful too. And then there's a CBS, and there's a CLC, there's a bunch of different mid-ground for lactation consultants. And basically it's just a little bit of lactation education and you get a certification. And then you have to do continuing education to continue with that certification. And then the highest is an IBCLC. So that's an international board certified lactation consultant. And that one requires quite a lot to get. There's a few different routes you can go in, but either you need 1 million hours of shadowing an IBCLC, or you can go a route like me where you use your nursing background with history and anatomy and physiology, things like that. All of our nursing, schooling, education, in addition to additional lactation education. And then of course, a big test that we have to continue with continuing education as well.
I've heard it's pretty intense.
Yeah, it took a while, but with the nursing background, at least it was spread out over a course of quite a few years.
Yeah, for sure.
So when should somebody hire a lactation consultant? Is this something that every pregnant woman should consider? Is it only if you're having issues? Maybe should everyone consider a lactation consultant? And when would you establish care with a lactation consultant?
So establishing care in pregnancy is to me vital, and I think it makes an utmost difference. Number one, getting education, whether it's in a group setting, an individual setting, is so super important just to set yourself up for success. Because looking back on my own journey, that was one thing that really made the difference for me, is I felt like going into it, I didn't know what to expect. And just even with my first baby, having general newborn expectations can be helpful to know. So definitely hitting an education in the prenatal, but establishing care one-on-one with a lactation consultant really makes a difference because you can dive into your own health history and conditions, talk about anything that you're worried about being a quote unquote red flag for your milk supply. He's just really going to town here. And you can also dive into like any anatomy concerns that you may have, like inverted nipples or flat nipples is something that a lot of moms are really concerned about. So if you are concerned, it's really great to meet with a lactation consultant so you can see if it actually is going to be an issue, if it's something to watch, and just knowing like, okay, this is what I have, so I'm going to do this to overcome that when my baby comes. So just knowing what to do ahead of time can really be helpful. And establishing one-on-one, it's such a vulnerable journey. And when crap hits the fan, you need to know who to call. And when you know who to call before that happens, it helps to prevent emergencies. And because when your baby doesn't eat, it is an emergency, right? So it helps prevent those emergencies. And it also just creates a great relationship. So when we know who to call, we feel welcome to, I love to always say, I love to meet people before they have to show me all their goodies, right? And same with your other providers. It's nice to know, like, okay, we're going to establish a relationship before we have to get vulnerable.
Do you feel like for my situation, when it turns out that both of my kids had tongue ties, but it wasn't as well known when they were little. And so, like I said, with my son for the first 3 weeks, I cried at every single feeding. I'm crying every 3 hours because it hurt so bad. Do you think if I would have established care with a lactation consultant before having him, so during pregnancy, some of that could have been avoided?
Absolutely, because then you're calling the first time you cry, right? Instead of 3 weeks later, which can make a huge difference because by 3 weeks, your nipples are traumatized.
Oh my gosh, yeah.
So, and even besides oral ties, there's so many other things that we can do as lactation professionals, like just simple repositioning that can make a world of difference. So no one should be crying through feedings. It's normal to have a little bit of pain because everybody's practicing in the beginning, but it should never last.
So you just mentioned like tongue ties, and that was obviously part of my journey as well. Are you able to diagnose tongue ties? What are some things that a lactation can and cannot do?
So that is a huge discrepancy that I think a lot of people expect me to be able to diagnose things, and I can't. Whether it's oral ties or, certain conditions, like I technically can't even diagnose mastitis, right? Because they're medical conditions, and my medical license is only an RN, and you need a provider's initials in order to be able to diagnose. So while I'm trained to do oral assessments and I can tell you my thoughts and opinions and what I'm seeing from my assessment, I can't technically diagnose any oral ties.
Are there any other misconceptions that people often think you can do, but you can't?
For sure. Prescribe is a big one. Again, it's technically medical advice, I love to say, because we do need a full assessment and health history in order to create a good plan for our clients, but we are unable to prescribe things like even just simple over-the-counters. Like we shouldn't be telling you, okay, because part of the mastitis protocol is take ibuprofen for inflammation, but I technically can't say that. So I always just refer people to that. And a lot of people think, oh, well, why can't you give me an antibiotic for my mastitis? Well, I can't diagnose and I can't prescribe. So as much as I would love to be able to have those tools at my fingertips, that's why, again, establishing care prenatally so we can know who your providers are so we can kind of outsource those things to the professionals that can handle that.
Yeah. And in your profession, you kind of have to move quickly, right? Like when mastitis comes on, it's like, I want help right now. And you have to have those relationships already set up are going to be key to getting quick access to an antibiotic or whatever you need.
For sure. And that's the one unfortunate thing about breastfeeding is that any issue that comes up really is an emergency, right? Like whether it's pain, your baby's not eating, weight gain, all these things, like it's vital to your baby's survival. Like it is an emergency. So that's why, again, establishing care, you know who to call. Call early. Call at the first sign of something doesn't feel right to try to prevent some of those things. Because I've seen some people come in with horrible mastitis that takes weeks, but I've also had moms message me and say, hey, I think that such and such is coming up. Something feels swollen, not right. Great. Let's see if we can treat it quickly. So it's really just a game changer to have a lactation consultant in your back pocket that you know and trust.
Do you have, like if somebody comes to you and they're suffering and they need a prescription of some kind, do you have like a medical doctor or somebody that you work with that you can refer to them right away? Do you work with other professionals to make sure that they're taken care of? Like you have somebody right there?
Yeah, I definitely always, people majority of the time are comfortable with their own primary care provider or their OB/GYN. So if they're not comfortable with that, or if they don't already have established care, I a lot of times will use Tabitha with Loyally, and she's a great resource for people to use.
So you mentioned a couple things that you don't do, and there's really only a couple, but they're kind of big ones. Let's talk about the things that you help women with. So I'm going to just blurt out a few things, then I want you to kind of talk about your main areas of expertise that you assist women with. But I think about, obviously, my journey with pain and maybe readjusting feeding positions, right? Baby carriers. Do you help women with understanding how to wear baby carriers properly? Is that something you help with?
Sure, why not? And that's more of my mom to mom advice is what I like to say. But absolutely, and especially mom of multiples, learning how to feed in a carrier is like essential for survival.
It's like gold.
Yes.
Yeah.
So that's definitely something that we even talk about in my prenatal education class.
And I feel like you feel a little piece of superwoman when you're able to like walk around town and you're feeding your baby at the same time and you're like, I am doing this thing.
You're doing it and nobody knows.
Yeah, it's
exactly.
It's just amazing. What else do you help people with on a common basis?
Like you said, simple repositioning and adjusting latches is always my first go-to. So I love to try to be as hands-off as possible because I want moms to feel confident feeding their babies when they're not in my office or I'm not at their house. So I try to be hands-off. Let's see what you can do. I love to empower moms, and that's really our number one job is empowering parents to feed their babies and just to meet them where they're at. So you're going to feed your baby however you want to feed your baby, and that's the only way that you're going to be successful. So that's something, a big discrepancy of lactation consultants in general, is a lot of people think that we only help moms nurse at the breast, which isn't always true. Our job really should be to help them feed their baby in whatever capacity that looks like for them. So a lot of my job is helping people transition to formula or using supplementation if it's required. Pumping, returning back to work is huge for moms, especially in our society. So having support during that transition is super vital if they wanted to continue breastfeeding up to a year. Other things that we can do is help with bottle feeding and bottle refusal, and a lot of times work hand in hand with other providers and practitioners to help make all these pieces happen. So that's something that all lactation consultants should really focus on, is seeing the mom for where they're at and giving the support that they need.
So do you help with understanding, like helping a woman set up her pump and like flange sizes and just all these pieces that are just another thing to learn when you're in that season of overwhelm?
Yes. And I always leave it up to the mom and when they want to learn it. So a lot of times, a lot of the moms that I have as a life cycle package are establishing care in prenatally, and then I see them all the way through weaning. And a lot of those times I will give them, because we do a one-on-one prenatal education class. So I will give them the option, okay, you can either bring your pump and we can open it up. We can learn how to use it. We can flange fit you right after birth is what I say, but we can know how to use it if you want to wash it and have it ready to go.
Oh, that's awesome.
Otherwise, a lot of moms are like, well, that's not my goal. I would love to exclusively nurse until I'm ready to go back to work. Great. Let's leave it in the box. And then 2 to 3 weeks before you're ready to go back to work, let's get that pump out of the box. Let's learn how to use it. Make sure your baby will take a bottle and those kinds of things. So I really leave it up to moms. But yeah, it's a super important piece to know if you want to be able to pump and provide human milk when you're away from your baby.
That's huge. And you said you do home visits too. You have an office in Appleton, right?
Yes.
And you go home.
Yes. And actually come August, I'm going to have 2 offices in Appleton, which is exciting. And I do home visits in like the greater Green Bay, Fox Valley area.
Now, one other topic quick is that you mentioned weaning. How do you support a woman during the weaning process, whether she's the one initiating or the baby is the one initiating?
For sure. So my lactation consultant training always tells me to tell moms that babies should tell mom when they're ready to stop, right? But we all know that that's not always reality. So I, like I said, run my practice where we're going to meet moms where they're at and support them on what they want their journey to look like. So it's really just up to them. And I've had moms want to wean for various reasons. They get pregnant with another child, or they just want to be done for their own mental health, whatever that may look like. Or they might have a 4-year-old and they're like, okay, how do I get them to stop? So really it's different, whatever stage that they're at, but there's tips and tricks on how to wean at any point in time.
Awesome. So I want to know a little bit more about your life cycle package. Can you tell us, obviously you said it starts during pregnancy, goes all the way through weaning. Tell us a little bit more about the package in general, though.
Sure. So I am partnered with a group called the Lactation Network that can accept some limited insurance. So I always send people there first to see if we can bill directly to insurance, which covers majority of the package with a small out-of-pocket cost. Otherwise, I take HSA and FSA and other forms as well. And I'm always open to payment plans if insurance is not an option for people. So that's really nice to kind of overcome that barrier. And one of the beautiful things of private practice. So I love to meet moms one-on-one during pregnancy. And if they do a group class, I still love them to come to my office or go to their house one-on-one so we can dive into their own personal goals, their medical history, any concerns or fears that they personally have. And then basically I'm on call for them around their due date. So I love to see moms within 72 hours after birth. So things are kind of going off without a hitch in the beginning, because typically most hospital births, which hospital lactation consultants do the absolute best they can, but a lot of times they're understaffed, things like that. And they're seeing so many moms that just delivered and they're kind of breezing in and out of your room quickly. So, and then they send you home and you're like, now what? So a lot of my life cycle clients, I say, if you're having great hospital support, awesome. I want to see you when you get home. And so my first visit for any life cycle package mom is I come to you for your first visit. Because really when you go home, even if breastfeeding went great in the hospital, now you have all your own items. So let's get you set up here. And then after that, I say we have 2, I call them SOS visits. So anything that comes up, you feel like poor weight gain, nipple pain, mastitis, anything that comes up for you. Otherwise, the next scheduled visit, I say, is when you're returning to work. So I say 2 to 3 weeks before you go back to work, let's meet again, talk about this transition. And then I come back again around 6 months or whenever you're ready to start feeding solids. And we can talk about how the breastfeeding changes again. And we can talk about what you want your weaning plan to look like and things like that.
Wow, that would have made such a huge difference. Oh my gosh,
For
that's
sure.
amazing.
Yeah, this was a great first episode, a great overview so we can understand how much value you can really bring to a woman and her family. I mean, when feeding is going well for the mom and the newborn, it ricochets into the whole family, because when it's not going well, I can speak from experience.
Yes, absolutely.
Everybody feels it. So I think what you're doing is absolutely incredible. All right, well, we're going to have a few more episodes with Abbey, so make sure that you stay tuned for the next one. Thanks, Abbey, for joining us.
Thank you.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.